today we're going to be discussing how to implement an action plan for Fiji. Fiji is located in the Western Pacific geographic region and is a developing nation striving towards creating a better and healthier environment for its citizens. This being said, Fijian citizens cannot take on challenges such as eradicating certain health issues and dealing with the ever-so-resilient burden of disease.
The top 3 causes of death in 2010 were ischemic heart disease, diabetes, and stroke. Ischemic heart disease has stayed at the top of the causes of death since 1990, despite the fact that there is an integrated policy for cardiovascular diseases in Fiji. Diabetes has moved up from the 5th cause of premature death to the 2nd position in 2010. The amount of people with type 2 diabetes are increasing as trends from 1980 to 2008 show that the mean total cholesterol, mean body mass index, mean systolic blood pressure, and mean fasting blood glucose have all increased. Despite the fact that an integrated policy exists for unhealthy weight and obesity, diabetes is still increasing up the ranks of the top causes of death.
3 main public health issues that Fiji should address urgently falls into 3 categories: low GDP, lack of education about different diseases, and the poor infrastructure. We will be discussing the reasons why these are public health issues and what we can implement in order to help reduce or even eradicate these issues.
Okay, first, we will discuss the low GDP in Fiji, which contributes to a lack of funding toward healthcare. Fiji only has 1 private hospital, which is an individual who can afford the high costs of treatment. A majority of Fijians depends on public health system for healthcare.
However, these public health facilities are subpar and lacking in medical supplies and are short of staff. For example, interventional cardiology and cardiac catheterization are both services that are not offered in Fiji. Considering that cardiorespiratory disease is one of the top causes of death in Fiji, this is a big problem. A majority of the residents of Fiji cannot afford private healthcare because it only earns $60 to $80 per week. This amount of income can only feed a family of 6 to 8 members.
In order to raise the GDP to improve the healthcare, Fiji should improve their tourism. This could create more jobs for the residents. Currently, Fijians working in tourism earn the most money. In addition, increased spending for visitors and residents can add local business and, as a result, improve the economy.
Infrastructure is an important means of access to getting the appropriate healthcare. A poor network of roads and bridges makes it difficult for citizens to reach hospitals, clinics, and other health centers. This problem is especially severe in rural areas where the roads remain unpaved. These roads must at least be stable enough for the public to walk and bike across. Another key problem in infrastructure is the unhealthy water supply. This unhealthy water supply is causing an increase in diarrheal disease due to the fact that it has not been upgraded since the colonial periods, causing the pipelines to decay and contaminate the water.
In order to repair the infrastructure, we will set up a toll system for large vehicles. The larger the vehicle, the more damage it causes to the roads. So, in order to compensate for and repair the damage, tolls will be collected from these vehicles on main roads or highways. This way, owners of larger vehicles will limit unnecessary travel, thus preserving the roadways. The toll collection will help repair any damages caused on the roadways and can also be used to supply clean water and repair the pipeline system.
Secondly, we will discuss the lack of education of diseases that cause the highest number of deaths in Fiji. Non-communicable diseases such as stroke and heart attacks account for 77% of all diseases. To lower this number, programs should be implemented in order to educate people about the specific risks with these diseases and how people can live a healthier lifestyle.
This program can be put into action by recruiting volunteers and training them in order to spread awareness in their areas. Volunteers may call a gathering at a public place or go house to house and educate people. Awareness will be spread on topics such as obtaining exercise, drinking, smoking, personal hygiene, and high blood cholesterol. As a collective group of Canadian health professionals, we advise the nation of Fiji to implement the above outlined action plan in order to help increase the quality of life within the nation. With a few simple and low-budget steps, Fiji will be well on its way to creating a healthier environment consisting of an efficient healthcare system, awareness among the public, and accessibility to health resources and clean water. By fusing the trends from the past with our future visions for the nation, we will be able to implement this series of action plans in a timely manner. In adopting these proposed set of plans, the citizens of Fiji will be able to outsmart the health issues that they have been waging war with in the past.